this is Tammy Lamora. I'm a labor and delivery nurse, and I also teach childbirth class for the Women and Children's Center. And I'm going to do a tour for you today, just to show you what to expect when you come in for your delivery. So this is the main entrance to the hospital, and this is where you would come if you were coming in during the day. We have this main entrance is open from 5 a.m. to 6 p.m. currently during COVID times. It does change to a little bit later, not COVID times. It closes at 9 p.m., but just know that this entrance is not open at all times. And you will always need to go through the ER entrance, and we'll show you that also during the tour. Anytime you come to the hospital, you have to have your temperature taken for COVID, and they will ask you some questions. And those questions change on a regular basis depending on what the questions are for this time. So the elevators are down to the end of this hall when you come in the main entrance. So make sure you go all the way down to the 2 elevators. So if you don't come in the main entrance to the hospital, you would want to come in the north entrance to the left of the emergency room, and that way you can come in through this area. There's only the 2 ways you can get into the hospital currently during COVID times. Hi. So this is the vestibule for the elevators when you get off, and what you're going to do is come over here and press this button, and they will say, "Hi, can I help you?" And you say, I think I'm in labor, or Dr. Dodge sent me in, whatever. And then they'll let you in. And I'm gonna let us in right now, but you will see this green light and you'll hear that noise, and that means that you can go in. So this is labor and delivery, and what we do is we come up here and you just tell the nurses why you're here, and then we'll get you on the scale, and then we'll bring you to a room. So you just say, "I'm here, I think my water broke," or "I think I'm in labor," or for whatever reason, and then we'll get you on the scale. So we just bring you over to this scale, and we do your weight and your height, and then we either will bring you to a room for labor and delivery, or we will bring you back to the recovery room where we check to see if you're in labor or your water's broke or if you're definitely staying. So we'll start in the recovery room right now. This is the recovery room. We have 2 beds here, and what we use this for is like a triage area. So if we're not sure if you're staying or not, we would start you off here. And what we can do is put you on the monitor just like in a regular labor room. These are the belts that go on your belly. These are the monitors that we use to monitor both your contractions and the baby's heart rate. And what we do is we put you on there and we see if you're contracting. And then if you think your water broke, we can do a special test to see if your water broke. And we just monitor you for an hour or so, depending on what your cervix is doing, and see if it's time for you to stay or not. Once we know you're staying, then we'll put you into a labor room. We have 5 labor and delivery rooms, and they take a long time to clean after someone goes in there, so we just want to make sure that we're only using them for people that are actually staying. So while you're back here, we're going to do a full head-to-toe assessment of you. We're going to monitor the baby for at least a half an hour, because we have to make sure your munchkin's doing okay and see if you're contracting or not, and then see if your cervix changes or not. And based on those different things will depend on how long it takes for you to be here if you're just not actually here to stay. But it is dependent on quite a few things. But this is where we start a lot of times, just so we can just make sure that you're definitely staying before we do put you into a labor room. This is also where you would start if you were having a scheduled C-section for some reason. And I'm just telling you that because anybody that's pregnant is at risk to have a C-section at some point. So I always make sure you're aware. So you would just start here if you were having a C-section, and this is where we would pre-op you for this surgery. Right here past these double doors is the OR. It's only 2 doors down, and as you can see there's a red line on the floor, which just means that we can't go past there in our clothes that we have on now. You have to have special clothes. So it's 2 doors down this way, and on the other side where the other rooms are, it's only a couple doors down too, so it's very close by. We also have a blanket warmer for both mom and baby, so that's really nice to make sure you guys are nice and cozy. And see those dinosaurs on those cute little blankets? And so at any time you think you need something like that, we can make sure you're nice and cozy. So if you are staying, then we would bring you to a labor room. If you are not staying and it's not quite time to be here, then we would send you home and give you instructions on what to look for labor.